Hi, good evening, friends. I'm Dr. Mahesh Nair, back once again with another YouTube live session. And this time, the topic, one second, it's going to be a little darker. Yeah. And this time, the topic being implants used in plastic surgery. Well, I was asked about this actually on Instagram, and I thought of going in for the YouTube live because I need more followers. Yeah, I need you guys to come to my YouTube channel basically to see the videos and to understand what all plastic surgery can do for you and how you can benefit with it with minimal possible risk and always try to get it done from a board certified plastic surgeon. It may not be me, it can be anybody else, but yes, go to the proper doctor for the proper treatment. So beginning this session with the whole bunch of questions that I have gathered to discuss over here this time. Let's begin with something as simple as what are the basic types of implants that are available in cosmetic surgery or in plastic surgery? Well, to begin with, we can begin from the regions of the body, such as the face, wherein we can use implants, and the breasts, as we all know. Then I'm first talking about the most commonest implants used, and then we'll go to the rarer set of implants that are also used in the body. So the commoner ones are the facial implants, the breast implants, the buttock implants, the calf implants, and later you even have implants in the deltoids to make them look more, what I can say, bulky, and you have pectoral implants, which make the pectoralis major muscle look more meaningful and more muscular. So these are the different types of implants. They're basically grouped according to the region, and all of these implants are more or less made with different grades. I wouldn't say grades, but different what I can say thicknesses or consistency of silicon. So they basically are silicon because, as we all know, silicon is inert to the human body, and it does not react. We do not get any like allergic reactions to silicon as such. So you have even your knee implants. I won't be discussing knee implants and hip replacements and all. That's not my field, not my field of expertise. But yes, you're in Pentac Aesthetics, Cochin, where I practice. Basically, we do all these implant surgeries in the most sterile possible environment, and literally guarantee you that there won't be any infection following it, or and that your surgery will go really smooth. So coming to the beginning with facial implants, we have facial implants, we have breast implants, butt implants, and also facial implants. Basically, we begin with cheeks. You have cheek implants, you have chin implants, you have jawline implants, you have nasal implants, of course, which are which are famous and infamous also for various reasons. And in the face, you can even have customized implants. What that means is basically we do sometimes a CT volumetry or stereolithography basically for the face, and you can decide and design the volume and the type of implant that you basically want. But that is mainly in the reconstructive field. So that comes when you have got some facial asymmetries or deformities, and you need to correct those. That is the time when you need like peri-Rombergs. Half the face is a little ahead and behind and offset, and then you need an implant like that. Or maybe in a cleft palate patient, wherein the maxilla, or the Binder syndrome, where the maxilla is a little behind. There you can have customized implants. But conventionally speaking, in the cosmetic world, we deal with standard implants. Those are your malar shields or the cheek implants. Very soon, an Insta post of mine is going to come. I just did a case today, so this is like the piece what has remained from there. So this is silicon implant, and you can see how soft and movable it is. But at the same time, it is firm, so that when you place it here, it does not move or go anywhere. So that's like how a cheek implant basically sits on the cheek to give you more projection to these bones, so that your cheeks look a little bit fuller, and at the same time, it also gives a little bit of a lift. Like, for example, look, you've got the skin envelope here. You put something inside this, the skin envelope stretches and it lifts the rest of the face. That is the same principle what is followed for what is followed with fillers. When doctors say that adding a filler to your face will make your face look fuller and it will look lifted. That is the same thing an implant does, but in a permanent fashion. So all of these implants, whatever I'm discussing today, are permanent in a sense, as well as you can even remove them whenever you wish. So they're permanent and not permanent at the same time. They will not cause you any harm, even if they live in your body for the rest of your life, because they're chemically inert. They do not react with your body. And if you wish to ever get them off, you can even do that. That is not an issue. Another small surgery is required to just take them off. So that is the cheek implant, what it does. So it fills up these under eye deficiencies, the hollow eyes, and the dark circles and all can be definitely reduced with these cheek implants. There are different types. Some of them sit on this bone, some go onto this side slightly, like extending from here, basically all this region. So they extend till here. This region of the bone or your cheek on the side also comes out. So we use these techniques basically to feminize or masculinize the face. So I do these facial feminization surgeries in transgenders, basically trans women or trans men, to make them blend more in their trans roles. So yeah, that's where we use these powerful tools like cheek implants or maybe chin implants to make the face look more masculine or feminine. So this is how a chin implant looks. Well, this is not a chin implant, this is actually a chin spacer. So based on this we decide what size of implant has to go inside. So this sits like this over here. Don't mind my beard, I'm sorry about it, but yeah, it sits something like this. So you get this implant projecting your chin in a vertical plane as well as a projected forward plane, wherein it adds volume, it adds what I can say, a definition to the lower face, and at the same time it stretches the skin, so you get a better jawline and you can get rid of a little bit of your double chin as well. There's an Insta post of mine wherein you can see a young man getting a chin implant along with a buccal fat removal done so that he gets a chiseled lower face. So it's very, I can say, easy to chisel your lower face out with, say, a chin implant along with, maybe a chin lipo and a little jawline lipo contouring. We use ultrasonic liposuction like Vaser and all, along with power assisted lipo to take out the fat. But fat can be taken out only from this line joining this angle to the tragus. So only below this line in this region can safely be liposuction done. I mean, there are people who do experiment with liposuction on the cheeks and all, but frankly, it is not documented in literature, and it's a little too scary to go into those regions because of the multitude of because of the multiple nerves lying there. It's not safe, and a lot of structures. So basically, jawline contouring can be done with implants and other modalities combined, maybe even a little buccal fat removal or maybe adding a dimple. That all works really fine. Then you have nasal implants. Nasal implants are mainly used for those who are scared of taking the rib. I mean, not the surgeon, the patient, because there are many people who do not want their rib to be taken. You may get a scar over here. Trust me, it's a very small scar. It's something like about 2 centimeters max to max. We go in, we take a small piece of rib, and that is like used to, give you cartilage support to your nose and make it look even more sharper and better. But in many of the Western countries and all, people do use silicone implants very widely and very successfully also. Even here we do use, it's not that we don't, but any given cosmetic surgeon would love to use your rib or your conchal cartilage, along with the temporoparietal fascia or maybe your rectus fascia. I don't use temporoparietal fascia normally. I prefer using the rectus fascia because it's right in the field of the rib. So any of these things can be used because they are your natural products. But again, yes, silicone implants like this do go to make the dorsum of your nose or the projected part of your nose more sharper, better. Your tip can be supported better. So yes, implants do work in the nose as well. So these are facial implants. Now again, people ask, are they safe? Well, yes, they are safe. That's why they are being promoted by, certified by FDAs world over, US FDA, you can say CE certification, Korean FDA, because Koreans use a lot of facial implants. So South Korea is a very booming industry for cosmetic, it's a booming cosmetic industry. So definitely they have their own standards, which are pretty global, and they use really good quality stuff. So implants are safe. How long do they last? Well, yes, they last you a lifetime. You don't have to do anything for them. They're just lying there doing nothing at all. I mean, yeah, giving you the result, no doubt, but they don't move. They don't have any moving parts. They're just there, and they will remain just there. So they are safe. They do last. And can you feel the edge of the implant, especially in the face? Many a times, this is like a little dicey question because see, suppose you have a chin implant, okay, you have got a thick pad of fat over your chin, so this implant hides behind that. You can't feel it. A breast implant, you can't feel it. If a surgeon has used a good size of an implant properly in the proper plane, you will not be able to feel it. But mind you, a cheek implant over here can sometimes be felt if your tissues are a little thin. If your cheek skin or the soft tissues there are a little thin, then yes, they can be felt to certain extent. But after a few months, usually your body puts some tissue in and around that, and they get masked or blurred out. So you don't have to worry that my implant will be seen or it can be felt. And definitely some of the implants which we secure with screws, titanium screws, say the cheek implants or chin implant, I don't secure with screws. I just use sutures to hold it there. But a cheek implant, yes, I do use screws to bolt it down. Those implants, those screws are not palpable. You cannot touch them, you cannot feel them, and they can't be detected on, say, x-rays and all, because x-rays they are seen, but they won't ring a bell when you go through the airport security and all, because they are made of titanium. They are not made of cheap quality steel or iron or something like that. They're titanium. They are also inert to your body. They don't cause any foreign reaction or anything of that sort. So that's about the safety. Can you feel an implant? Yes. Yeah. And other small instructions which are there around implants, we always tell patients that these are all put intraorally. Usually, you chin implant can be put from both ways. You can take a small nick over here in this groove, and you can insert this whole thing, because it's so easy to bend and mold this. So we cut this into pieces, and I mean, we shape this, we trim it, and then we insert it. So it goes to a 1 centimeter small incision. So you can go either inside the mouth, outside the mouth. For the cheek, you go from inside the mouth, so there's no scar on the outside for a cheek implant. Jawline implants are also similar. You can go from inside the mouth and insert them there. They start from somewhere here, they come down here, and then they can go here. These are highly customizable. You can customize it to any shape, size, or this thing that can suit you. Of course, your skin envelope should be able to conceal it, and then it will look definitely good on you. Even the nasal implant can't be felt as such, but yes, it sits in a very good plane and it works just fine. So a few instructions are: do not sleep on your face, of course, after you put an implant, say for a month, because it can get dislodged. Do not sleep on your sides. Avoid doing that for some time, at least 2 weeks or so. Otherwise, the implant may shift. So those are the little things. Do not get involved in a physical fight where somebody punches your chin and the chin implant shifts. So all these things have to be taken care of. What is the downtime? Downtime is really not much for any of the facial implants. About 2 to 3 weeks, you have some swelling of the face. Most of the swelling is in the first 3 days, and it just goes off by the end of the first week. So don't panic, don't worry. You don't need an off from your work for, say, more than 2 3 days, because nowadays the masks are still mandatory kind of at places. So you do wear a mask. You can conceal most of your implants as such. It won't leave a very gross swelling on your face for a very long period of time. Don't worry about that. So facial implants, what is the downtime? Yes, we have been asked that regularly. Now coming to the other, what I can say, body implants. Okay, in body implants, you have, yeah, I did mention, right? The cheek implants also have a lifting effect. Yes. Now body implants, you have the most commonest implant which we do very frequently. In fact, yesterday only we had a case, is a breast implant. Now, yes, everybody would like to see how it looks. So this is how a breast implant looks. This is a smooth surface, round silicone cohesive gel implant. So that's how it is. It's plano convex. It's flat from the base and curved from the top. That's why it's plano convex. The fill differs with the type of the implant. So these are Sebin or Sebin, what it is called. It's a French implant basically. And yes, its fill is a little less, but because it has to mold. So when it is kept vertical, it sits in a proper, say, like a teardrop manner. Look at this. The upper pole is flat and the lower pole is round. That is why its fill is limited. If it's 100% filled implant, like there are some other brands like Motiva and all, they have 100% fill implant. So they will not have, they will be projecting more. You need more projection. They will look more voluptuous. So those implants, it depends who wants what. So when a lady or a trans woman asks me, like, doctor, what implant would suit me? I first ask them, what is your vision? How do you envision yourself with the implant? Do you want a very high implant, very big projection, a very good cleavage? What is it that you want? And according to that, we decide which implant to go in for. Maybe but definitely, nonetheless, the most I mean, the US FDA approved implants, which are the smooth implants and the nano textured ones. So these are the nano textured ones. You can see how opalescent they are. this is transparent nearly, and this is opalescent. So these are nano textured implant. They have a very fine leathery texture, but it's not coarse. The coarse ones are banned. I'll come to the BI, ALCL, and all those SCC kind of doubts what you all have in your mind. Recently, we noticed some dermats circulating some videos here and there, stating that implants are bad, implants are unsafe. We would rather recommend you to read proper literature and see what is right, or consult us, because we are the ones who are dealing with implants, not they. So a dermat does not go and put implants. A plastic surgeon goes and does it. So it is best that a plastic surgeon speaks of it than a dermatologist or a physician or somebody else speaking of an implant. It makes no sense, frankly. So choose your surgeon wisely, or choose your doctor wisely, who's going to operate on you, who knows everything about it in and out. We are not here to sell the implant, just we're here for your safety as well, because our reputation tags on it. We cannot just sell you something which is banned by the FDA or the government and say that still it is safe. No, it need not be. We can stop using it, just like how the coarse implants went off the market. They are not there anymore because everybody put their foot down, like, no, nothing doing. We cannot sell this stuff because it is somehow correlated to an incidentally found carcinoma or lymphoma, basically a blood cancer kind of found incidentally with an implant. So yes, they were banned from the market, and legitimately banned. Nothing wrong with it. So these are basically breast implants. They sit in the breast in various planes. To decide how these are put, we even have something called sizers. So look at this. This is convexo concave, or concavo convex, what you call. This is concave from this side and convex from this side. So it even has a nipple to mimic how a breast would look. So these normally we use in the brassiere when the woman comes for the consultation, and these are kept like this and like this, so that you come to know exactly how the implant is sitting on your chest and how it would look. So these are various sizes. So this is by a company called Polytech, which is German, and you have this is what, a 220, a 250 cc size 6. So we can try various sizes before we zero in, and this you can the result of which you can see in real life in 3 dimension, rather than some computer animation, which will not give you a very accurate estimate of how heavy will it feel and how will it look when you look down on it, when you look in a mirror. So we have these panoramic mirrors where you can see on yourself how a chest sizer or a breast sizer basically looks on you, and what size of implant would you like to go in for. Then accordingly we choose the implant, and then it is inserted. Like, we go in from numerous approaches. One is the periareolar, around the areola approach. That is like, suppose if this is the nipple, can you see this? Yeah, I guess you can. So it's just over here. So you go around from there. You can even do a little bit of breast lift in that setting, no doubt about it. And along with that, or maybe you can go under the chest, under the breast, basically in the inframammary fold, or the fold below the breast. So you can go in from there behind the gland. So don't worry, your lactation is not affected, your sensations are not affected, your blood supply is not affected, nothing is affected. Of course, you may feel a little numb because of the anesthesia and all for roughly 3-4 weeks maximum, but then all your sensations, your nipple sensations, your everything comes back. Even lactation, breast implant surgery does not affect lactation. That's like a given, because we go behind the breast gland. In some women where the soft tissue is less, where the tissue is less over here, we may go in for behind the muscle. It's not a bad thing. Generally, I've noticed that my Indian patients here who usually come, they have this kind of fed into their minds that the implant behind the muscle is a bad thing. No, it is not a bad thing. If there is no soft tissue on top, if someone is like an A cup, where will we put the implant? We'll have to put it somewhere, right? So it's safer to put behind the muscle, so that we have various techniques of doing that, dual plane, this plane, that plane. So a lot of techniques are there. We do that, and we ensure that you get a good result. And there's another plane called the subfacial plane, which is between the gland and the muscle. So we don't go behind the muscle, we go behind the gland, but behind one more layer called fascia, the pectoralis fascia. So this implant can sit even over there, safe and sound. So that's how basically an implant is put into the breast. And then the sutures are taken in a very fine manner. They are generally dissolvable, so you don't need to come back to me for stitch removal. Yes, you need to come back to me to show me the result and how you feel with the implant. And if you have any other doubts and queries, infections, I've not noticed yet anything like that around me. But yes, they can happen. A blood clot can happen over there. A little fluid collection can happen. All these things can be taken care of. They're very minor complications. There's nothing something very, very major. coming to, addressing the elephant in the room, yes, what we have come across recently over the last decade is the BIALCL, or the breast implant associated anaplastic large cell lymphoma. I know, very big name, a very fancy name. What it means is it's a type of blood cancer, basically. It does not spread in the blood, basically. It's found in the fluid which is surrounding the capsule of the implant. Okay, it was usually found there. It was not a metastatic or a like a cancer which traverses your lymph nodes, bones, and all everywhere. No, generally the women who are found to have it incidentally had an implant. So it's not like the implant led to it, but yes, most of those implants that were found with the ALCL were the coarse textured implant, which are no longer in the market. So that question is, it's answered and it's out. You don't need to use those implants which have been probably implicated with the carcinoma or with the lymphoma. So that is one thing about BIALCL. Second is recent evidence that some squamous cell carcinomas were linked to an implant, but there is no cause effect direct relationship till now. Probably a double, there is no randomized control trial or something that has gone about with it. But yes, more and more data is pouring in, and till then we can't really comment whether an implant will lead to a squamous cell carcinoma or not. It has never ever done so, but not until recently when it was diagnosed. But there is an advisory by the International Society that one has to be careful, one has to be explained that these possibilities do exist. It is not that, see, nothing comes without a risk. When you buy a car, you don't tell the car manufacturer, will I be never involved in an accident? Nobody can tell you that. So neither can a surgeon predict that, yes, you are going to get a squamous cell carcinoma or an ALCL along with this. Everything carries its inherent risks. Like, for example, when you go in for a facelift, there is a risk of your facial nerve, some fibers getting damaged. It is a given that we will try to safeguard it, because it matters to us, that your face moves after the facelift. Our result, the success of our result depends upon how happy you are with the surgery. So definitely no surgeon, no plastic surgeon would like his patient to suffer uh, due to some, of course, if it's some unforeseen circumstance, then yes, we can't help it, but we will be there to handhold you and to help you through your course, because it affects us as well. So definitely we do take care of that aspect. And that's why I always make it a point to explain all my patients that, see, these risks are real, they do exist, but that does not mean that we stop doing breast implants or something just because they've not yet proven it that it occurs because of that. If it occurs because of that, the next day there'll be a ban on implants, guaranteed. There's no doubt about it. Because frankly, the pharma industry, basically the industry which manufactures implants, doesn't make that much of a hell profit as much as a Dolo 650 company would be making. It's not like the world survives on implants. It's a luxury. It's not something which is a necessity. So it's not that $1 billion industry which is going to crumble down or something. They can be shut down very quickly. Like how the coarse implants disappeared, so can these if some hardcore evidence is found. So be rest assured that we are not working, that we are working with you, for you, not against you, just to sell an implant. So, because implants have come a long way over the last 4 decades. I mean, they came from like saline filled implants. Now you have cohesive silicone gel. Okay, the big words cohesive silicone gel, what that means is basically if I cut the implant in half, the gel is not going to flow out. It won't lead to any complications in your breast, even if it ruptures. You might find some YouTube videos where a few colleagues of mine only have done it, rather. They have taken a car over the implant, and it's shown that the implant doesn't rupture. So it is a very solid, safe entity. And yeah, unless you're stabbed in it, we can't probably safeguard that. But there has been even a case where a bullet ricocheted from an implant in an American woman, and it saved her. So yeah, even that can be attributed to the benefit of the implant. Coming to the more commoner questions that I get after for these implants are, again, sleeping on the side, doctor, when can I do that? So breast implant, obviously, if they're going to sit like this, and if you turn and you pressurize them initially when they are not yet fully settled, they're going to move, or they're going to dislodge from their pocket a little bit, shift here and there. That is very common. I mean, not common, but that can happen. So we advise you, as far as possible, keep two pillows on your sides and sleep straight. Sleep on your back for at least 2 or 3 weeks, or at least a month till they settle down. Usually, the time for an implant to settle down completely is about 3 months. So the suture line settles in about 15-20 days. It doesn't give you any problem. There's no stitch removal. There is no dressing. Sometimes most of the women wear a sports bra after this. The surgical bra is not needed usually in cases of an implant, because usual sizes what we go in for, something like say 230, 245, 275, 300. Of course, in trans women, we go for 400, 450, 500, 550. I've even gone till 650. So, yeah, different sizes, different modalities of handling them. The smaller sizes, you may not even wear a bra. If you wear a bra, you want to wear a sports bra. You should not be wearing an underwired bra for a very simple reason. There is an wire or a plastic piece underneath which can cause an imprint in the healing tissue over there, and it may lead to the implant, settling a little, one up, one down, or something like that. So first of all, wear a correct size bra. Secondly, wear a good supportive bra. Wear something like a sports bra, which has a good amount of padding and good support on the back, from the back, because implants add weight to the body. Mind you, your chest will feel a little heavier after the surgery. Now, say this implant is 265 ml, which is roughly 265 grams. So that is nearly 250 grams sitting on your chest on either side. So that's 500 grams added to your chest. It's not a very light weight, but it's not a very large weight either. But imagine those who are putting 550 plus, that's a significant weight coming on your chest. So be mentally prepared for it. That that weight is going to come after about 3 months or so. You come to equalize, you normalize or neutralize that effect, and you feel good about it, like, okay, fine, now the implants are settled, and I got the look what I wanted, and that's how it is. So yes, there is a small downtime after the breast implant, maybe about 2 3 days, after which you can definitely resume all your work. Some of my patients have started from the very next day, if it's a desk job, because you don't have to move your chest, you just have to sit and work with a laptop. So that can definitely be done. You don't have to take a long downtime, I would say, like a week or 2 weeks, rubbish. Nobody needs to do that. Implants can also be used in something called augmentation mastopexy, where we increase the size of the breast and at the same time lift it. Mastopexy, breast lift. So you can even use an implant with that. After that surgery, yes, there is a downtime of say a week or 10 days for the suture line to heal and the implant to settle and everything to come back to normal. So definitely that also is there. And sleeping on the side, downtime. So most of the common questions I've answered. It's like they last you a lifetime. They're not going to disappear. They're not going to come down in size. Yes, with age, see, we can't stop aging. So with aging, your skin is going to sag, and with that sagging, the implant also sags down. Plus, it adds weight to it. Imagine 250 grams pulling you down. So that's how larger breasts sag earlier. So will a breast implanted breast sag. It's inevitable, but maybe about say 10 years, 15 years, 20 years down the line, at least till that time, you can enjoy the feel of an implant, or maybe what you've always envisioned yourself, like I want my silhouette to look like this, my breast should match my butt and it should look all good. So yes, that all can be what I can say, lived for those 10, 15, 20 years, whatever. And everybody's breast need not sag at the same time. Some women have a very thin skin and it sags sooner. Some the genetics and the skin quality is good, so the skin will sag even later. So that's very subjective, we cannot predict that. But yes, whenever it sags, we can use the same implant again for creating the lift with implantation mastopexy. Or if you want a different size at that time, yes, we can go in for it. There is no problem. That can definitely be done. So that's about a breast implant. I know I spoke a lot about it. So the butt implant is also something like this. There are 2 3 types. This is a plano convex. So they have a convex surface and a plane surface, where this sits on your butt muscle and this comes onto the skin surface. But they're much harder than this, much firmer, because your butts are supposed to be firm, not soft and squidgy. So you can have butt implants. There's no problem with that. They're safe, they're long lasting, there's no issue as such. With a butt implant, of course, some precautions, like you don't sit on your, but anyway, you don't sit on your butt, you actually sit on your thighs and the ischial tuberosity. There are two bones which actually support your weight. You don't technically sit on your butt. So we do give certain specific instructions after a butt implant, that you have to take care this way. And the best part is, breast and butts, you can even change the size, or increase them with the same implant. Like, you keep the same implant and graft fat in and around it. That's called hybridization. So hybrid surgeries, wherein it's hybrid breast augmentation or hybrid butt augmentation, Brazilian butt lift. So you put an implant, and at the same time, because we have no implants for hip dips, hip dips cannot be corrected with implants. So you put a butt implant, and your limited fat that you have, you can graft it in and around the implant and around your hip dip. So you get the best of both worlds. Okay, so That also can be done. Then you have calf implants, which are gaining a lot of popularity. That instantaneously people want athletic looking calves, wherein the gastrocnemius muscle, normally it is that muscle which gives your calf a definition, along with the soleus lying inside it. So gastrocnemius and soleus, two muscles, big names but two muscles. Gastrocnemius will have two heads, inner head, outer head, and underneath that the soleus muscle. So all these three give the bulk to the what I can say, the calf, and it looks like an inverted champagne bottle. So to get that look, it's very simple. You need again an implant which is more longish like this, to make it look like the calf muscle, and that is then inserted underneath the skin, underneath the fascia over there, to make it look more what I can say, athletic. Yes, and you can again put some fat in and around that to blend it in. Fat grafting can be done. Yeah, another doubt whether a breast implant can be touched and felt. No, trust me, it's very deep inside. You can't feel it. Nobody can even tell you whether actually there is an implant there or not, because many a times if it is put properly, it looks so natural, and even the feel is natural. You just cannot make out whether an implant is there. Even for a trained hand or a trained eye, you cannot easily make out whether an implant is there if the job is that good, or if the breast is that good in its tissue architecture to conceal the implant that way. So you have calf implants, then you have deltoid implants to make these your deltoids look more round and muscular. So if you don't have good deltoids but you have good bones, you can enhance it. You have these what I can say, pectoral implants, biceps. So generally it's very easy. You just do fat grafting and they look good. There's no problem. And these are not fat grafted, by the way. So triceps also you can make it better by doing liposuction over here, getting this groove. Chest implants, yes, you can use pectoral implants to make your chest look more masculine, but that nowadays has more or less been taken over by fat grafting, because you do intramuscle and above the muscle good amount of fat grafting, and it stays there. It looks good till you maintain the same body weight. So if you're going to lower your body weight by 5-6 kilos, definitely this fat is also going to go. It's not going to stay there lifelong. So but if you maintain your body weight somewhere in the +2 -2 kg range, more or less the fat stays there. It does not go away anywhere. So you can consider it as a permanent, semi-permanent surgery kind of. So I hope I gave you all enough info about different types of implants. The commoner ones, which you frequently use: chin, cheek, nose, breast, butts. Those implants are the ones which we commonly use. We don't use calf implants and pectoral implants that often. But I guess I have given sufficient information for this small YouTube live session. If there are any more questions, you can ask in the comment section, or email, WhatsApp. Ask me on Instagram. Dr. Mahesh Nair is my Insta handle. So you can get in touch with me by a lot of ways, or get in touch with my numbers that are displayed on Google, and I will make it a point that I personally answer all your questions. Okay. So thank you for joining in this live stream. Have a splendid weekend, and see you next week with some good topic, which is interesting and informative at the same time. Okay. Take care. Have a good evening. Bye bye.